Brian, I want to pull you into this conversation because you worked as an aide for former President Donald Trump, so you might have a gauge on what Republicans are after. Do you know what their plans might be if they retook the House and the Senate and were a majority in Congress?
Sure. I mean, I think the idea is going to be what can be done to increase patient choice and control. 90% of the spending in healthcare is not done by patients. It's done by government programs. It's done by health insurance companies. We don't have a patient-driven healthcare system. We really have a bureaucracy-driven healthcare system. It's one of the reasons there is so much political fights in healthcare. It's because half of the spending, half of the revenue that insurers and hospitals get comes through government programs. So there's huge power in influencing the federal bureaucracy and politicians. So I think what we need to do is depoliticize healthcare, restore patient control, expand things like health savings accounts that allow patients to control their health decisions. And also look at what is inhibiting competition. There's a lot of government policies that restrict doctors and providers from best meeting patient needs. Things like certificate of need laws that prohibit hospitals from expanding capacity in certain places. And of course, we need to be focused on policies that enhance innovation. I think there's a lot of concern coming out of the government's response to the pandemic that the public health agencies need significant reform. And I think that would be a focus for Republicans in the next Congress.